you go.
Waiting to order.
Fill the prescription.
Yeah.
And you might have had.
And we're live. Yes.
But you still needed something to keep it.
Get done halfway.
And he agreed to go to the
No
hospital.
public comments? You're sitting up here, you get the right to talk. Health and Human Services voucher, or minutes first. Motion for the minutes?
Make a motion to approve the minutes.
Is there a second? The nod? Yeah. Any discussion on them? Not, all in favor, say aye.
Aye.
Aye. Opposed, carried. Now we get down to Ashley.
Right. Good morning, everybody. I've been super busy. I'm sure everybody else has too with their ball. What's every night? All right, well, we'll go ahead and get started. I'll send around out of county travel first. This is primarily a lot of trainings for ADRC and public health. At the end of this month, Brittany Magnuson, our new financial person, and I are going to go to the new financial managers orientation in Wausau. It talks a lot about the programs and reimbursements and everything that Health and Human Services uses to get reimbursements and things. So her and I are going to go try to learn that. Laura obviously already knows that, but this is a good, I guess, foundation for Brittany and I to learn all of those things. And it was recommended by the regional people for us to attend that to learn. So I have that along with everything else.
Yeah.
I don't know if you guys want to see the agenda for the orientation or not, but I brought that.
Yeah.
Any questions about any of out of county travel? Then we'll go right ahead into vouchers. Most of this stuff is standard every month. Access is our ESP services, using Aurora for jail education groups, their staff going into the jail. Advanced Mental Health Solutions, that is who we use for our CSP program. That's all on page one of the vouchers. Next couple purchases from Amazon were office supplies, specifically for the ADRC department. Then we have some foster care payments. Samantha Bauer, Amber Boss, those are all individuals who are receiving reimbursements for having placements, either kinship or foster care. CISA 10 is our Birth to 3 program. Chris Mark Home, I think 3/4, almost all the way down on page 1. Those are adult services. That is a placement. So adult services placement. We have City of Ladysmith. That was a child support service. Couple more kinship care payments, and then last one, Family Farm. Center. Page 2, we start off again with some more Family Farms charges. Obviously, that is for the center as well. Below that, we have Flambeau printing. There were envelopes that were made for ADRC and child support and Veteran Service Office. Couple of foster care and kinship payments below that. Then you can see all of these Kalahari payments. Those were CCOP, so community options. That is part of the CLTS program. They allow payment for hotels if like it's an educational purpose and recreational. We have started out with about 80,000, I want to say, give or take, a year in that program, and for 62,000 left for the year after those payments. So all of these individuals went to the autism conference. So
Right up in the Eau Claire leader.
oh, that's particular.
I'll just talk about
No.
it later.
I didn't.
Somebody on the county board was complaining that it was $86,000 went to.
Since she couldn't stop that, she voted the Journal, whatever it's called, house. Got the article here.
Oh, interesting.
Which-
Yeah, I'll be curious to.
Kind of a disconnect between the two of them.
Right.
It was called like she wasn't educated on
Yeah.
where this money comes from.
It's so
It's still making the
Not
paper with different
related.
parts of CLTS.
Oh, but that's it. It's all in human services.
Oh.
Is there what, I got the article, 3 point something million dollars behind. So,
Okay. Well, that finishes that page. Though was sorry, that was the autism conference. And I think that we sent there were 28 kids that were in the program that their families went to the conference to learn. That's what it is. It's about basically educating in different ways and things that can help a child with autism live their best life and things like that. That's what the conference is for.
it's a multi-day thing.
Yes, yeah, it's a few days. And some families, if they bring their kids with, they can bring their respite provider too. So their child's taken care of and then the parents can go and participate in the conference without having to worry about like where their child is and taking care of the kiddos. So then that brings us to page 3, which is more Kalahari. Then we'll go down, about halfway down is our last Lad Lake payment there. That was 1537. So that young man that we placed with a relative is doing very well. Knock on wood. Knock on wood. Is that one? 15. 15? Yep. So that is our last payment to Lad Lake. He is doing well. The relative became licensed as a foster home. So that is where he is at and continuing to do well for the time being. About halfway down, we have Ladysmith News, printing the source that is for ADRC. Then the last Ladysmith News charge was for our advertisement for the citizen committee member in the paper. So that was 207. Sarah Siegler is our birth to 3 coordinator. Couple more kinship care payments. Have options counseling. That was Koinonia. That was somebody who went to AODA treatment for adult services. And then we have Rosa, who is our interpreter here. Another CLTS benefit. It's the guitar lessons that Melissa Pico provides. Chilling supplies, that is more supplies for the senior center. The kinship payment towards the bottom, and then we have Starlink is for the ADRC, the internet and things. So we at the bottom of page 3. Half of the page is staff work, so the individuals work like in home cares for individuals and senior services. We have Sunlight Assisted Living. There are 2 individuals through adult services that are placed in those homes or in that home. So them are adult service placements. Then we have Cisco, more food for the center, more kinship and foster care payments for together. Tomorrow's Children, that's 16,000. That young man is set to be placed with family at the end of the month. So that is going well. As like he's been doing visits in the family, but getting some education. He is a kiddo with high needs and high behaviors. So we're taking that transition very slow, but the transition period is going well, and we will see how that goes. So hopefully things will go well when he's out of the residential placement and back with family. Then we have our Trempealeau County. Those are adult service placements as well. Unemployment claims. And then University of Wisconsin. Those are child welfare, like the foundation trainings that all the new workers have to take. Bottom line there is the kinship payment. Go to page 5. Several Verizon Wireless. Those are all of the cell phones it broke down per department that each worker has. Walmart, raw food for the center. And then by a microwave. And the spring conference, that one is for or not social service, senior services as well. Department of Administration, network access for child support and economic support. That is a monthly reoccurring charge as well. Department of Children and Family Directors Dialogue, I believe that's for Carla, child support. And then last, we had a refund for the LTS pay. Any questions?
Where's the sunlight? Light is distant from, okay.
Right. It's
It used to be, isn't that the one that used to be
Magna
Magna
House.
House? Yeah, Bryce Lake.
I can never remember that, yeah.
Any other questions? Motion on travel and payment vouchers. Or a second? I'll second. Any other discussion? I'll pass Ashley's schedule around, when she's gonna go get educated on how to get all these millions of dollars.
Oh, yeah.
All in favor, say aye.
Aye.
Opposed, carried.
So next up, I know everybody noticed that packet is very thick today. We do have, Laura and I were able to get all 38 of our budget forms done. That's why the packet is so large today. Okay. So there are a couple, I don't know if anybody's had a chance to go through it. There are a couple where right now we're projected to be over. But we don't have up-to-date reimbursements from MA and multiple programs. So that stuff isn't going to be reflected yet. So the only thing that I'm concerned about us going over budget on at this point in time is our adult services budget. Because there's so many, I'm not quite sure. I should have numbered the pages.
I can remember
It would
the
have
budget
been.
report. Okay, no.
No, they're not. Services. Okay, it's budget number 463. It's right after like the CCS page. Which page number? Counter.
Back for next time.
I know, I'm gonna do that number. Number the budget for.
Probably skipped it all.
It's like almost towards the end. It's like the page right before my signature page.
Yeah, so
I should have just left it.
Okay.
All right,
Wait a second.
all right.
Well, they're not numerical order.
Go from the
They're
back,
not.
the one right before her official signature page. 6-3. Everybody good?
Okay, so this is the one where we will likely be over budget, and that is because of a few different things. We have high cost placements in adult services right now. And I did put the reason for concern on the bottom there. High cost placements, because we have individuals placed at Trempealeau in these group homes, Winnebago, that all comes out of this budget. We also had an employee leave, and the benefit payout wasn't in their original budget either, so that wasn't calculated for prior, so that is part of this. Yeah, for services and the benefit, or salaries and then the benefits. So that is why that one is likely going to be over at the end of the year. And I would say mostly it is because of those high cost placements that we have currently.
Sure.
But that's really the only one at this point that I'm very, I guess, legitimately concerned about us going over. The other ones I think will be okay. But like I said, we will be doing these every month. But this is definitely the one that we need to keep an eye on.
Know how much the employee benefit was part of that?
Not on this sheet, but it's on like the Excel spreadsheet that Tanya sent and that Laura reviews. It is in there. Probably can pull it up for you if you want me to. I can find it. What do you want me to do that? No? Okay,
You can do it, follow up on it.
okay. All right, and then just a couple things that I've noticed when we were doing these, there were a couple budget forms that there's like 2 accounts, one for sure that we haven't used in years, that's just been sitting there. And that is, the line is called, the budget name is temporary assistance. There's like 8,000 or $18,000 sitting in there. I'm working with Laura and Ashley, Heath and Tanya to try to figure out where we can move that and how we get that to where into an account that we can use, because this has just been sitting there. It's from a really old program from probably since before I started here. It's just been sitting there. And there's another one to W2. The program has changed a little bit, but we do have funds sitting in there, but we don't use them here at the county. So we need to figure out what to do with those allocations, which I think is about $8,000. And then the case management budget name, it's budget number 472. That was budgeted for the CSP billing, which we were paying to Aurora, but we're no longer doing that because we're doing CSP billing here in-house. So that one isn't really needed anymore either because we're taking care of the billing here. Otherwise, I guess another one that's typically a concern is the children and family budget, but knock on wood, was out of place. And in residential facilities, that's costly. So right now that is looking good. So that's what I have for the budget. And there was a change to this. So there was a memo sent out earlier this week that we need a motion in this meeting to approve the budget forms. And that the minutes have to reflect that. And then I have to send the approved budget to Ashley Heath, so she keeps track of it. So Phil doesn't have to sign off on 38
Neither do you.
forms, and I don't have to do it either. I just have to sign off one sheet, and then you just need the motion. So that was the newest way to handle this. So we'll need a motion to approve
Does
that.
anybody have any questions on this form first?
You talk about the prevention, there's money coming in, but it seemed like it's 3 years. But there's no expenditure.
Yeah, I have to look into some of these. Some of them I don't really know much about. And like, I know that Chris was going to look into that as well as to how she could start using that. Then there was another account. It was the intoxicated driver program. There's $141,000 into that account. But according to Laura, that was supposed to be taken out last year of our budget and put,
Yeah, sure. It's been transferred somewhere.
and it wasn't.
Yeah.
So it's still sitting there in our account. So there are some things that I need to look into that I just don't understand yet.
That can probably be transferred into the regular budget.
Something where we can use it, yeah. I'm not sure, because they were gonna take it last year and I don't know. I just don't know what happened with that and why that wasn't.
Yeah, you'd have to go back.
Because Laura did say, she's like, I'm surprised that that's still there because they had talked about moving it. So
I think
I'm not
that was
sure.
one of Jeremy's budget reduction items, that they were gonna remove that from our budget and put it somewhere too, but I don't know where.
it's just something that I need to look
Well,
into.
probably found out somewhere that the transfer was a little more difficult than they thought.
Yeah, or maybe it couldn't go where they were thinking. I don't know.
Yeah, because I mean, wherever the money originally came from, I think you have to try to, like this temporary assistance, like it started off in economic support. I would imagine that we have to put it into like a like program, and just move it all wherever. So looking into how to best handle that with Ashley and Laura, so. Then CCS and CLTS, those are 100% like MA reimbursable programs. So I'm not concerned about either one. So.
Okay, the motion's on the floor. In favor, say aye.
All right.
Oh, I thought they did.
I don't think we did it.
We'll get it.
I was like, whoa.
Either you or I were napping. I don't know which one.
No, there's no motion. I know there's no motion.
We need a motion. Any second.
I'll make the motion.
Second.
That gonna.
Okay, now can I call for the vote?
Now you can.
All those in favor of the motion, say aye. Opposed? Carried. Jump ahead to our honorable guest.
Yeah, so we'll jump down.
If nobody has any objection.
So we just have a new staff today to introduce to all of you. So this is Alexis.
Hi.
Do you want to speak to Alexis?
Sure. So Alexis started 3 weeks ago with us. Is that right? Yeah. Been a whirlwind so far. She's a new BRIA worker in Children's Services, so she'll be kind of the first face for parents used to our department who have we have to respond to for the purposes of abuse and neglect. She's doing great.
Yeah, she's been showing up every day. So
Pretty long day.
Alexis, do you want to tell everybody about yourself a little bit?
I don't know what to tell. I'm from Rice Lake originally. I graduated from Eau Claire. Yeah,
She's ready to be a
Jump right in.
child protection worker
I have jumped right in.
at first.
Welcome.
So this is our Health and Human Services Board. We meet every month. We don't have anything else. That was just really quick introduction. She's new staff and I wanted to bring
Wants
her
to get
out.
Back to work.
She does. She's like.
Yeah.
Well, thank you
Thanks for
guys.
coming.
Thank you.
Thank you.
Nice to meet you.
Thanks, Alex. All right, vacant position review. Right now, the position we have, well, it closed last night, was our children's long-term support worker. So what happened with that was, we did have somebody that was going to start. Remember, we were waiting for them to start after the school year. It got about a week out before she was supposed to start, and then she emailed and said that she had taken a different opportunity that fit into her life better. So then we had to re-recruit for this position again. So that closed last night. When I checked yesterday, there were 8 applicants. So that is promising. We did interviews on Monday. For elder Tuesday, okay, the elder benefit specialist. So we have to wait for some things to clear out their waivers and things like that to see what's gonna happen with that position. Today at 11, we have interviews for social service worker, so the last position hoping to fill in children and family services. We have 2 today. So that is, I think, it for vacant positions in health and human services. I don't have any requests to fill forms this month. Maybe next month. I know. Public participation notice for July. I just kind of wanted just to give you guys a heads up that next month that will be, it's gonna be advertised in the paper. It's statutorily required that we have a public participation meeting. every year, 46.031 parent 3. We have to advertise it in the paper. We have to submit the meetings. Meeting minutes to the state. We have to talk about budget, met needs in the county and the services that are provided. So next month that will happen. The advertisement, do you know when it?
I think the last week in June,
Okay.
which turns into July.
It will be advertised, and so next month we will do that. And I am working on a document that talks about all of the services and like meetings and boards that all of the Health and Human Services staff participate in. I've been reaching out to other counties to see how they do this, because this is new to me. And that seems to be what they're doing, is just like a document that just addresses monthly meetings, ongoing meetings, annual meetings, quarterly meetings, and what everybody participates in, so the public is aware that those things are happening. So that will be ready and included in the packet for next month. And then citizen member update. We had 2 letters of interest.